Hello and welcome to Triage, timely conversations for healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Welcome to Triage. My name is Limo Charan. I'm one of the healthcare lawyers at K&L Gates. Now, I'm here today with two of my colleagues to talk about artificial intelligence in healthcare. I have with me today Rebecca Schaefer, who is the partner in the healthcare group in our Research Triangle Park office, and Clarita Sullivan, who's an associate in the healthcare group, also in the Research Triangle Park office. Welcome, Rebecca and Clarita.
Hey, Limo. Thank you. Good to be here. Thanks for having us.
Thank you for having us.
Well, let's dive right in. Artificial intelligence is something that everybody's talking about, and it's a pervasive and transformative tool across industries, across the United States. And healthcare is really no exception. And I really want to talk to you about something that just came out recently from the Department of Health and Human Services with respect to AI in healthcare. Clarita, can you tell me what's going on?
Yeah, absolutely, Limo. So on December 23rd of 2025, so just a couple months ago, the Department of Health and Human Services, or HHS, as they're commonly known, their Office of the Deputy Secretary published in the Federal Register a request for information, or as our listeners will know, an RFI, on the adoption and use of artificial intelligence as part of clinical care. Comments were due by February 23rd of this year, and the docket already shows that over 190 comments were received from a variety of industry stakeholders, from healthcare providers to digital health companies, all the way to patient advocacy groups.
Clarita and Rebecca, how does this RFI fit in with the administration's overall?
Yeah, so I'll jump in there, Limo. Clearly, I think we've seen a lot of pronouncements from the current administration looking to accelerate the adoption of AI in different industries to unencumber technology developers that are looking to innovate in the AI space. And I think this is a continuation of that arc or that line of dialogue. I mean, we've seen AI executive orders, we've seen OMB memoranda, we've even seen just somewhat contemporaneous with the RFI Clarita described, an HHS AI strategy that was published earlier in December about how the agency is looking to make AI function to improve public health, healthcare delivery, biomedical research, human services, and agency operations. That strategy document was more internal looking for the agency's operations itself. And I think this RFI is more external focused in terms of, accelerating adoption among the healthcare community.
So previously a lot of internal, but now looking external. So let's dig into the details of the RFI. What in particular is HHS looking for? Who are they interested in hearing from?
Yeah, so HHS is specifically requesting to hear feedback from two different groups. So the first group would be individuals and entities who are successfully creating and utilizing healthcare from these AI tools. And then the second group would be individuals and entities who are encountering obstacles or struggles to incorporate these AI tools. And the hope is that hearing from both groups on either end of the spectrum, that will inform HHS on how to encourage the use of AI in healthcare while still maintaining public trust in these AI tools, address any obstacles in incorporating these tools, and also dedicate federal incentives so that AI can essentially reduce burden, lower healthcare costs, and improve healthcare outcomes for all.
Well, it absolutely makes sense to try to get both ends, just figure out where it's working and where it's not. Well, let's talk a little bit about HHS's goals. How are they planning on using or assessing this feedback and taking further actions related to it?
Yeah, sure. So I'll jump in there. The RFI is broken down among 3 domains. And so practically speaking, HHS is focused on receiving feedback that it can use to adopt new regulation or inform new regulation as one domain. A second domain is how, the views of these different constituents in the healthcare community or industry can inform reimbursement policy. Again, all is impacting AI adoption. And then the third domain is what may be relevant considerations in terms of AI use and tools adoption for facilitating research and development in the life science or other healthcare space. And so I think, notably, and I take some comfort from this as someone who advises, regulatory lawyer advising, providers and other stakeholders in the healthcare industry on regulatory matters. Take some comfort that HHS expressed that they want to adopt a regulatory stance that's predictable and transparent. Another phrase in the RFI is risk proportionate. So, mindful that AI obviously is a novel technology is certainly going to have a lot of risks, but not having that completely dissuade or, discourage adoption. So risk proportionate regulation. And all of this, I think, is hopefully toward the end of fostering some trust. And also the predictability point is helpful for the regulated community as they consider where and how to invest in AI adoption.
Well, do you think that risk tolerant or risk informed aspect would actually sort of encourage submissions? I mean, again, you worry about whether someone who has a success wants to share it or who has an obstacle wants to share it. Do you think that that sort of goal setting really impacts the willingness for responses?
Yeah, it's fascinating. So I think we've looked at a number of the comment letters that are, been published to the docket for the RFI. And I think people are engaging in the process and providing, robust answers. I think really hoping to meaningfully inform the agency if the agency is going to, use the information to take further regulatory steps. So, I certainly don't think anybody's disclosing their strategic plans, right, or their trade secrets. But I do think people are being candid about the challenges they're facing, the, points of uncertainty they're facing, and how predictable and reliable regulation could probably help with some of those issues if the goal is to accelerate adoption.
It totally makes sense not to develop something that's going to end up later being regulated. If you can get comments in and get the agency to be looking at it on the front end, absolutely makes sense as to why people might be responsive. Let me ask you about another aspect of this. Obviously, for healthcare clients and other stakeholders, reimbursement is a really big consideration in terms of healthcare. So how does the RFI, or does it even address the questions of reimbursement?
Yeah, sure. So, and, Clarita, feel free to chime in too, but I'll start with, I thought it was really interesting that the RFI began by, in the reimbursement section, admitting that government designed fee-for-service programs or payment policies and coverage decisions are slow, right? They evolve slowly. And, AI is obviously evolving at a breakneck pace. And so HHS wants to solve for these shortcomings by seeking feedback on payment policy and changes to create incentives for AI adoption in clinical care. I actually was going to ask you, Limo, in reverse, if you're aware of, since HHS is calling out fee-for-service, for example, as maybe a limited reimbursement policy approach for this, if you're aware of other initiatives by this administration in the value-based world or otherwise that might intersect with these AI topics.
There is actually some development of digital health-focused ACO models, which will be the subject of a future podcast. So I'm not going to go into that here, but I do want to say that the administration is thinking about this in the context of models within administration, particularly in the ACO model. So they are coming. They've announced some. There's some details which we'll be covering in a future podcast. But the reality is that, yes, you have to figure out a way to incentivize the use of AI, appropriately so that it is reimbursed, or else people are not going to do it. And this is why I'm glad to hear that they're doing this in the context of this RFI as well. You mentioned that the comments had passed. Is there any other deadlines or dates that our listeners should be concerned about?
Yeah, so as I mentioned earlier, the deadline to submit comments was February 23rd of this year, but even if our listeners did not submit any comments, they will still be able to view HHS's consolidated responses and copies of schedules on the regulations.gov website, which we can link in the podcast episode for our listeners.
Great. Now, Rebecca, you had mentioned that you'd actually looked at some of the comments. What kind of comments have been received?
Yeah, Limo, I guess I'll start with some themes from a particular constituency or stakeholder group, which is multi-jurisdictional, large hospital and health systems. And they somewhat consistently made a call for federal leadership to create a supportive regulatory environment and, in particular, ensure predictable and consistent regulation at the federal level in the hopes of helping contend with what is otherwise emerging as a patchwork of differing state requirements.
That would make sense, absolutely, for multi-state, because otherwise they're going to be looking at just a series of different and potentially conflicting regulations.
Yeah. And so then even, absent those multi-jurisdictional considerations, I think another set of themes that emerged was certainly embracing the request for information about how to craft reimbursement policies that are going to, provide incentives. And other comments were wanting clarity around consent requirements and privacy and security considerations. And those go towards, addressing liability if clinicians are going to adopt this into clinical care, and also go toward promoting patient trust. And then, I think a third theme was looking for transparency and accountability for AI developers. So whether that's through common technology standards or otherwise, I think that was another call for at least from the provider community for ways HHS could help issue standards or regulations that could accelerate adoption in clinical care.
Rebecca, I have a question about that, though, because I guess I could certainly see why the provider community would want sort of that type of consistency or anything like that. Mm-hmm. But wouldn't an AI developer basically say, hey, this stifles my creativity? And part of the reason that each of these entities that is developing AI is trying to differentiate themselves is to not necessarily try to be consistent. And I would think that those stakeholders might actually not want that sort of
Oh, sure. Yeah. And I think what's interesting is, this administration, deregulation in the name of innovation, I think could be a fair, observation about some of the executive orders and other pronouncements. So, yeah, I think, again, I'm speaking from having read, themes in a provider letters, but you're absolutely right. That's a bookending perspective of the technology developers is, don't stifle my creativity with your regulation.
As we're coming up on the end of our time, I just wanted to say thank you guys for being here. And just wanted to see if there's any final takeaways that our listeners should be thinking about in the context of this RFI.
Yeah, Clarita, you want to jump in?
Yeah, so as Rebecca mentioned, there were, I think, about 190 comments thus far. And so with this robust participation in the RFI process, from individual patients all the way to stakeholders like AI developers, to health plans, providers, and life science companies, HHS hopefully feels like it has received the representative and meaningful information to help facilitate the adoption of AI. In terms of next steps, we will stay tuned to what the agency does with these comments and how the learning is applied through upcoming rulemakings, guidance documents, technology standards, and other pronouncements that may be coming out.
Well, it really does sound like we're just at the beginning of this process. So I really appreciate you both taking the time to join us. And thank you for our listeners.
Yeah, thank you, Limo. It was great to be here. Great to talk with you.
Thanks again for listening to Triage, timely conversations for healthcare professionals. New episodes are available for download through Apple Podcasts, Google Podcasts, and Spotify. By subscribing to Triage, you will receive timely notifications for each new episode. Also, if you have any topics you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.